Thanks, Cahirlach. I think it is important to do as other TDs have done, which is to draw attention at a time when we're rightly applauding and pointing to the role that Defence Forces staff can play, to point to the reality that these people have been underpaid, underappreciated for a very long time, to remember the extreme exploitation of Defence Forces that takes place, 85% of them on less than the average industrial wage, over 120 relying on the working family payment simply to survive. And it has to end. It can't just be some rhetorical commitment to what a great job these people are doing, and similarly the nurses and so on. If you're serious about what you're saying about the importance of these roles, then you have to pay these people properly, and you have to give them the right to be organised in a trade union. Workers need to be provided with everything that they need to do their jobs safely. That means Defence Forces, it means all the other workers on the front line being given access to the personal protective equipment that they need. And that is not currently happening. I want to read a message I got from one health worker in Tala Hospital just yesterday. She said, "I work in a hospital. Today we had ambulance men come onto the wards several times to bring patients in or collect them to go to another place. They had no PPE when dealing with COVID-19 patients. They were told the hospitals have to give it to them. We don't even have enough to use because of how quickly the virus is growing. I think this is disgraceful to put the paramedics' lives in danger like this. Also, our PPE is not good enough. No surgical hats, no visors, just ordinary masks, not the right ones, and we're told they can't get them. We need to support those who are fighting the virus on the front line. We need to ensure they have the masks, gloves and other protections that they need. The same goes for other essential workers in supermarkets, in delivery companies. They need to have the screens, they need to have the hand sanitizers, they need to have the masks and every other equipment that they need. And we need to decisively put public health ahead of private profit and private property where it comes to it, to ensure that that happens. In France, weeks ago, they requisitioned PPE to ensure those who needed them got it first. They also put price controls on hand sanitizer to stop the profiteering. And the price gouging and the profiteering, which I highlighted a couple of weeks ago, is still ongoing. I got an email just this morning talking about hand sanitizer, which was previously on sale, a small bottle, for 99 cents in January, on sale for €8 at the moment. Similarly, massive increase in terms of the price of face masks. The government has the power under the Consumer Protection Act 2007 to introduce price controls at the stroke of a pen. You should do so for hand sanitizer, for PPE. We need to requisition private supplies of personal protective equipment so it can be directed to where it's needed now. And we need to redirect production to make testing equipment, PPE and ventilators as quick as is possible. If not, workers again will be left with no choice but to take action like those in An Post in Dublin 15, who last Monday refused to go out because they didn't have the hand sanitizer that they needed and they didn't want to put themselves and the communities that they serve at risk. They did the right thing by refusing to go out. Other workers who take similar action will also be doing the right thing. Incidentally, I would appeal to An Post management, reverse the decision not to pay them for the work they had to do on Wednesday to make up for the backlog as a result of the correct decision they made on the Monday. These workers should be applauded for protecting themselves, their families, their communities, not penalised by An Post. Finally, on housing, we need emergency action to protect workers, renters, those with mortgages. Nobody should lose their livelihood or their home because they take proper precautions to avoid the coronavirus. No one should end up in arrears on their rent because they can't go to work. Landlords have been given a break on their repayments to the bank. Renters must also be given a break. We need an amnesty for all affected by the crisis, for rents and for mortgages. They should be written off. This is not a time for half measures. We must have a complete ban on evictions. The government currently proposes a half ban, stopping new evictions, but proposing to allow them to go ahead if the RTB says that they can. It's not good enough. nobody should be made homeless during this emergency. And nobody should be made homeless after the emergency either, due to rent arrears that build up during this crisis. That will be nothing more than a brief stay of execution. I have an amendment to ensure a complete ban on evictions. I'd urge others to support it, to clearly put public health before private profit.